Imagine you're driving on a highway. Everything is going smoothly. Cars are moving. Traffic is flowing. Suddenly, boom! A huge traffic jam blocks the road. Now nobody can get through. Believe it or not, that's exactly what happens during a heart attack. But wait, what actually gets blocked? And why can it become life-threatening? Let's find out. Meet your heart. Your heart is like a super hard-working pump. It beats around 100,000 times every day without taking a vacation. To keep pumping, the heart muscle itself needs two important things: oxygen, nutrients. These are delivered through special blood vessels called coronary arteries. Think of coronary arteries as delivery roads bringing oxygen and food to the heart muscle. Why does the heart need oxygen? Have you ever tried running while holding your breath? Not easy, right? Muscles need oxygen to work. Your heart is a muscle too. Since it works 24 hours a day, 7 days a week, it constantly needs oxygen-rich blood. Without oxygen, the heart muscle starts struggling. And if oxygen is completely cut off, the muscle can begin to die. What is a heart attack? A heart attack, also called myocardial infarction, happens when blood can no longer reach part of the heart muscle. The most common reason? A blockage in a coronary artery. Imagine a tunnel on a busy highway. If a truck gets stuck inside the tunnel, all traffic behind it stops. Similarly, if a blood clot blocks an artery, oxygen can no longer reach part of the heart. What happens next? No oxygen means trouble. The affected heart muscle begins to suffer. If blood flow isn't restored quickly, the muscle may become permanently damaged. And because the heart is responsible for pumping blood throughout the body, this can become a medical emergency. That's why every minute counts during a heart attack.
Causes of heart attack. So what can block the artery? Here are some common causes. 1. Blood clot, the most common cause. A clot forms inside a coronary artery and blocks blood flow. 2. Injury to the blood vessel. Sometimes damage to the artery can interfere with blood flow. 3. Certain drugs or medical conditions. Some conditions can affect blood vessels and reduce blood supply to the heart. The end result is the same: less blood, less oxygen, heart muscle in danger. Symptoms, the warning signs. How do you know someone may be having a heart attack? Watch for these warning signs. Chest pain. This is the most common symptom. Many people describe it as pressure, tightness, squeezing, heavy weight on the chest. The pain may spread to left shoulder, left arm, neck, jaw, back. Sweating. Sudden cold sweating can occur, even without exercise. Nausea. Some people feel sick to their stomach. Anxiety. Many patients describe a feeling that something is seriously wrong. Pulse changes. The pulse may become faster or slower than normal. Blood pressure changes. Blood pressure may rise or fall. Dizziness. The brain may not receive enough blood, causing lightheadedness. Shortness of breath. A person may struggle to breathe normally. General weakness. The person may suddenly feel exhausted or unusually tired. What should you do? Here's the most important part. A heart attack is an emergency. If you suspect someone is having a heart attack, call emergency medical services immediately. Keep the person calm. Get medical help as quickly as possible. Do not ignore the symptoms and hope they disappear. The faster treatment starts, the more heart muscle can be saved. Quick recap. Let's remember the story. The heart needs oxygen. Coronary arteries deliver oxygen-rich blood. A blockage can stop blood flow. No blood means no
oxygen. The heart muscle becomes damaged. This is called a heart attack or myocardial infarction. Warning signs include chest pain, sweating, nausea, anxiety, pulse changes, blood pressure changes, dizziness, shortness of breath, weakness. And remember, a heart attack is a medical emergency. Outro. Your heart works for you every second of every day. Understanding the warning signs of a heart attack could someday help save a life. If you found this video helpful, like, subscribe, and share it with someone you care about, because knowledge can save lives. See you in the next video.
Like, share, and subscribe Thera.